Migraines can become more frequent in the run-up to the menopause, in the perimenopause transition, and that's often because our hormone levels are fluctuating really quite wildly and they can provoke a migraine and recurrent migraines. Migraines are more than just a headache. They can be severe headaches which are accompanied by nausea and vomiting, by symptoms such as tiredness and fatigue, and also visual disturbances, and they can have a significant impact on the quality of our life. If your migraine symptoms are becoming worse in the perimenopause, HRT, hormone replacement therapy, can actually be very helpful to even out those balances in hormone fluctuations. And the best way to do this is by using HRT that's given as an estrogen through the skin. And that's because the levels in our blood tend to balance out a little bit better than using other methods. We know that using tablet forms of HRT is generally tended to be avoided if you're suffering from migraines, but other types of HRT can be really helpful.